Therefore, if your statements are potentially defamatory in relation to the identifiable person or entity, you will be directed to discontinue your remarks. It is imperative that you comply with any such direction. Before we hear from our witnesses, I propose we publish their opening statements on the committee website. Is that agreed? Agreed. On behalf of the committee, I would like to extend a warm welcome to the witnesses. Dr. Ola Healy, National Clinical Director of Quality and Patient Safety, the HSE. Dr. Michael O'Dwyer, National Clinical Lead for the Sepsis Programme, HSE. Dr. Ciara Martin, National Clinical Advisor and Group Lead for Children and Young People, HSE. I'd also like to acknowledge and welcome the petitioner. There's an apology from Joe and Karen Phoenix. They weren't able to attend today, but they are viewing the proceedings, so just welcome them online. Dr. Orla Healy will read out the opening statement. I suggest that Dr. Healy should make her opening statement for around 10 minutes. We'll then have questions and comments from members. Each member will have around 10 minutes, and that should allow members to come back in more than once. I now call on Dr. Healy to make her opening statement.
Thank you, Chair. Good afternoon, Chairperson and members of the committee. Thank you for the invitation to return to the Joint Committee on Public Petitions. At the outset, I wish once again to express my sincere sympathy to the families of those patients who've lost their lives to sepsis. I also wish to express heartfelt thanks to the families who've advocated and acknowledge the important contributions made by the Little Red's Legacy Campaign and other families who have assisted us in our work, and to thank you, the committee, for your attention to sepsis. We welcome the focus you have brought to this major cause of harm and the importance of raising awareness about prevention and early detection of sepsis. I will give an update on the progress made by the National Clinical Programme for Sepsis since our attendance here this time last year. As you've noted, I'm joined by my colleagues, Dr. Michael O'Dwyer, the Clinical Lead for the Sepsis Programme in the HSE, and Dr. Ciara Martin, National Clinical Advisor and Group Lead for Children and Young People in the HSE. In regard to updates on key priorities for the Sepsis Programme since last we spoke, we have launched a public awareness campaign for sepsis. That campaign was launched on March 7th with radio ads on local and national radio, social media ads and media interviews with additional coverage. The campaign aims to increase knowledge around the signs and symptoms of sepsis, as a recent research that we ran in advance of the public awareness programme identified that while people were aware of the word sepsis, only 44% of the general population were aware of the signs and symptoms of sepsis. The research involved engaging with patient advocates to help inform the communications. The call to action encourages people to find out more information on the HSE website and to ask the question, could it be sepsis if they have symptoms? The campaign, which many of you may have heard, is performing well. The radio ad is back on the air this week to align with the International Paediatric Sepsis Awareness Week. The Little Red campaign have kindly agreed to participate in media events during these weeks, in addition to other families who've experienced the devastation of losing a child to sepsis. Social media reach to date has been over 1.6 million across Facebook, Instagram and TikTok, and the social media ads will continue over the next few months. Since the campaign launched, the number of people visiting the HSE website each day has doubled, with 14,000 people accessing the information in the first 4 weeks of the campaign. We will evaluate the impact of this campaign to ensure its objectives are being achieved. This will also inform the future campaigns. Education and engagement with staff across our services is continuing. A campaign website was set up so that staff could access all of the sepsis resources. Reminders were sent out on HSE land of mandatory training requirements to all staff. Staff newsletters, podcasts and webinars included stories on sepsis, and interviews with staff from the clinical programme for sepsis were published across multiple platforms. 2 separate posters have been developed, one for adults, including maternity, and one for paediatrics on the signs and symptoms of sepsis. And these have been sent to GPs, which also directs them to a patient information leaflet, which is now available in 10 languages. An update on the Paediatric Early Warning Score, referred to as PEWS, to reflect updated sepsis guidance was completed and fully implemented across all paediatric hospitals and all hospitals who see children in June 2023. We identified the need to have PEWS trainers in regional and local hospitals where children attend. Myself and my colleague Dr. Martin are working with colleagues from Sailta Hospital Group and CHI to organise a national Train the Trainers Day in May, in the next couple of weeks in fact, where each hospital will be invited to send 2 representatives. In December 2023, a patient safety alert on sepsis was sent from the Office of the Chief Clinical Officer to all emergency departments which see children and all areas for unscheduled paediatric care to address the challenges of recognising and responding to sepsis in busy and overcrowded emergency settings. An additional patient safety supplement was sent to all healthcare services to provide further guidance regarding the importance of early recognition and treatment of sepsis. Many safety and risk reduction initiatives were developed as a result of this information sharing. The sepsis programme is working with the National Women and Infants Health Programme to share expertise and provide guidance on improving awareness of sepsis in maternal care and women's health services. Regular education sessions on the signs and symptoms of sepsis and the Sepsis 6 bundle are conducted across all hospitals throughout the year with audits to assess adherence to the recommendations. Revision of the National Clinical Guidelines. The Society of Critical Care Medicine Surviving Sepsis campaign have updated their international guidelines. This information provides important evidence and recommendations on the prescribing protocols for antibiotics and fluids in sepsis management. The sepsis programme have committed to adapting the sepsis tools used in acute hospitals to reflect these recommendations. This work will be completed this year. The full review of the National Clinical Guideline number 26 will take place in 2025. Resources for GPs and primary care healthcare staff. A quick reference guide for GPs on the recognition and treatment of sepsis in adults is currently in the final stages of review and will be implemented in the coming weeks. A quick reference guide for GPs on the recognition and treatment of sepsis in children is under development and will be ready for implementation in the first quarter of 2025. A project to commence integration of software to GP clinics to aid with sepsis awareness and management as a pilot is planned for later this year. Sharing expertise. The 8th Sepsis Summit will take place in Dublin Castle on the 3rd of September. This year's summit will have national and international experts and family advocates among those presenting. Public awareness champions and groups such as the Irish Sepsis Foundation and the Little Red's Legacy Sepsis Awareness Campaign have been invited to the event, and survivors of sepsis will be asked to speak at the summit also. The National Sepsis Report 2022 was published in December 2023 and provides very important data on the care, management and outcomes for inpatients with sepsis in the adult, maternity and paediatric populations. Quality assurance on the recognition and management of sepsis. Retrospective audits against the National Clinical Guideline for Sepsis were undertaken in 2023 in adult, maternity and paediatric inpatient services. Key learnings from these audits are used to improve care in the early recognition and management of sepsis. An infographic outlining data from the report in 2022 and the findings in relation to audits undertaken across all hospitals was sent to each hospital group CEO and chief directors of nursing in February 2024. The purpose of the infographic is to create an awareness of the burden of sepsis on inpatients and the impact sepsis has on hospital capacity and flow. The audit findings have been consistent since 2018 and identify key areas for improvement, particularly around the use of sepsis tools. The sepsis programme team have worked with the National Centre for Clinical Audit to improve the audit tool used. This will be tested in Q2 2024 and ready for implementation by Q3. The audits undertaken in 2024 will focus on the areas that require immediate improvement as communicated to all hospital and hospital groups through the infographic, and will be reported back to all hospital executive teams with recommendations on how to improve compliance. All acute hospitals have a deteriorating patient committee which has oversight on the management of patients with sepsis. This committee reports to the CEO or general manager on an ongoing basis. Our 5-year strategic plan. The Action on Sepsis 5-year strategy is now prepared and ready for consultation. The strategy outlines a 5-year strategic programme of work from 2024 to 2029. This comprehensive strategy, grounded in Irish data and international best practice, is structured to tackle the challenges of sepsis management and prevention. The strategy sets out a range of HSE actions aligned to the six priority areas, which are governance, preventing avoidable cases of sepsis, increasing awareness of sepsis amongst the public and health professionals, improving identification and treatment across the patient care pathway, improving support and care for sepsis survivors, and research on sepsis. A key priority of the strategy is to ensure that the changing structures of the health services are reflected in the delivery of these objectives. Part of the new structures will be in the National and Quality and Patient Safety Unit, reporting to the Chief Clinical Officer. This unit will work closely with counterparts in the new health regions, and a key priority of this work will be assurance that robust governance arrangements are in place with responsibility and oversight for the identification and management of sepsis, and that quality improvement processes are implemented and evaluated following audits and serious incident reviews. Finally, I once again want to express my heartfelt thanks to the families who've advocated and acknowledged the important contributions made by Little Red's legacy campaign and other families. This concludes my opening statement. Thank you.
Thank you, Dr. Healy. And just before I begin, members, I suppose it's only proper to acknowledge the efforts that the HSE and the likes of Little's legacy have made progress in the last 12 months since you were here last. So it's a continuing fight, I suppose, and a continuing struggle to keep going. Deputy Buckley? Or you wish to come in? Yeah, sorry.
No problem. And thank you, Deputy Buckley. Just to say, I concur with the chairman for the progress that we've seen. This was raised several times with the committee, but most recently we had good engagement in May of last year, and we said we would review this in 12 months' time, and this is the progress report, as it were. So I appreciate Dr. Healy and Dr. O'Dwyer and indeed Dr. Martin for your time and for your update to the committee. It's an important aspect of our work, and something that's been through the campaign of Little Red and others to raise and highlight awareness of sepsis. And this committee has been dogged in its determination to try and actually make progress. I have to say, I'm certainly impressed, having been critical last year of the pro forma nature of the way the HSE appeared to be treating sepsis awareness. That really, from what you've informed us today, is a real step change in what in the way it's handled and the way the awareness is being managed. It's very positive and it's very welcome. Could I ask, though, first and foremost, how many staff members are actually working on sepsis awareness within the HSE, please?
Thank you very much, and once again to acknowledge your contribution as a committee. As you correctly said, you have been dogged, and that focus has assisted us in our work. Sepsis awareness and the treatment and management of sepsis, either at a frontline clinical level or clinical governance or wider executive governance, is everybody's business within the HSE. That said, there are dedicated staff whose primary role is to cover sepsis. That in every hospital group, there's a senior nurse that it started off as assistant directors of nursing, and that's been upgraded to directors of nursing. So every hospital group in the country has a director of nursing dedicated to sepsis. They're assisted by other members of staff in their work, and at a national level we have a dedicated programme for sepsis with a clinical lead and a programme manager and other staff members within my own directorate in the quality improvement function of the directorate, who dedicate substantial time to the sepsis programme. So the whole time equivalent dedicated to sepsis varies according to the need and the level of work underway at a particular time. For instance, in recent months, we've had a dedicated resource from the HSE Communications Department.
Yes. Okay. So if we were to get to the actual numbers, apart from the time when there's a dedicated campaign running, and you might have support, as you say, from the comms office, or indeed other aspects within the HSE, if the director of nursing in the hospitals have a role to play, putting them aside, when we're talking about the actual national office, indeed your own team, how many are we talking about working on sepsis awareness within the HSE? How many people? Whole-time equivalents?
Deputy, I appreciate that you would like to have those specific figures, but it would do a disservice to the work being done by the entirety of HSE staff in sepsis and sepsis awareness, to limit that number to those exclusively dedicated to sepsis on a full-time basis. It would also do a disservice to the wider needs of the healthcare community and patients in regards to sepsis.
Well, I suppose in saying that, and the reason why I'm asking it is, when I cast my mind back onto our initial engagement, I think it may have been correspondence from the HSE, that when we pressed them as to what was entailing the sepsis awareness campaign more than a year ago, what we were told was there was a spike in funding, I think around 2019. I don't have the figures to hand, but it really consisted of a few posters, some conferences, some leaflets that were distributed across the country, but nobody knew where exactly it went. So I'm acknowledging that there has been a change. I certainly think it's much broader than it was. It certainly seems more targeted. It seems like there's more educational training. Everything that really this committee and indeed the campaigners have looked for over the years, it seems that it has now, been actioned, which I fully appreciate and I'm acknowledging here. You can appreciate though from our perspective that I get a little nervous when we can't get whole-time equivalent numbers. I appreciate if it's small, those individuals are doing a lot of work, but it would be nice to have figures, and you can maybe come back to me on that. The other element of it as well is that in terms of the resources that are there, you spoke of the international element, which is very welcome, but more importantly for the staff within the health service, awareness of sepsis was quite low. That's from our engagement previously. But if these training days and seminars and conferences and all that are being run, then obviously everybody's being educated about the risks. And as you rightly said, indeed, campaigners and advocates and everybody in the sepsis space are also sharing their learning as well with healthcare professionals, which has to be of benefit ultimately to the patients, and that's what we want to achieve here. So in terms of parking the employee element to one side, in terms of expenditure per annum now, what are we looking at of the spend on sepsis, the overall campaign, excluding obviously staff costs, because we're not going to get those numbers I take, so therefore we're not going to get the figures for staff, but let's exclude the staff costs. How much is the HSE spending now on sepsis awareness?
Okay. So just, I will come back to you with more detailed figures on the staff, but please. I should say that within my own directorate, which is Quality and Patient Safety, we have at any one time up to 60 staff working within that directorate, and we work across education, assurance, enablement, incident management, policy development, and that includes public awareness. We take a programmatic approach to the major causes of harm, and we move from one cause of harm to the next. Yeah. So to dedicate the entirety of one cause of harm on a permanent basis would not be an efficient or appropriate use of resources. Suffice to say that the resource required to meet the needs of the sepsis awareness campaign were dedicated to it. The same
Dr. Healy, just on something that Deputy Devlin has said, is there any actual full-time employees in the HSE just dealing with sepsis, or is it kind of everybody?
There are the directors of nursing. It's their primary responsibility.
That's in each hospital.
In each hospital.
But you're talking about the national office chair, right?
Yeah. In the national's office, we have the clinical program. Dr. O'Dwyer here is the clinical lead for the program, and we have a program manager. So there are dedicated sepsis resources. We've combined. Sepsis is a cause of deterioration, so we have combined the deterioration patient program and the sepsis program as they're closely aligned. So yes, there is a dedicated resource.
Returning to the funding then.
Returning to the funding. So we were in the fortunate position of having been awarded a Slán to Care grant this year, and we're also in the fortunate position of having had sufficient funds to run a research project to inform the public awareness campaign. To run the public awareness campaign on the basis of that research, and to evaluate the public awareness campaign. And on foot of that, we will be making submissions for further funding on the basis of those findings.
And actual figures, though, see what I'm really trying to, again, acknowledging the changes that have taken place. What was the funding, say for? Let's go back. I mean, if you don't have it to hand, I appreciate you can come back with a note to the committee. But really what I would like to see is from, say, 2018 through to current day, and hopefully, and I assume from what you're saying today to the committee, that there would be an increase in funding allocated to sepsis awareness within the HSE. One-off grants excluded, because it seems to me like more resources has been put to raising awareness of sepsis, which is important, but I'd say the figures speak for themselves. So if you don't have it, I appreciate that you can furnish that with the committee. But I'm looking back here at the April 23 opening statement by the National Clinical Officer, Dr. Colin Henry, at the time, and there was discussion around the funding at that time, and it was quite low, to be honest, and that was something we as a committee were critical of. So you might enlighten us a little bit more. Do you have any figures to hand today?
Well, I can. Certainly hundreds of thousands of euro have been dedicated to the existing campaign from within our existing budget, but I can provide you with the wider figures on the precise figures on the cost of the leaflets and the wider public awareness. But certainly the initial research was of the order of €200,000, and additional funding was added to that. But that's not the totality.
No, I appreciate that.
Yeah.
And a year-on-year breakdown would be great for that, just for our own benefit, because as I hear, even the strategic plan and everything that's taking place, all of that requires funding. We know that, but it's just to try and ensure that there's funding behind it and that the funding has increased year on year. But thank you very much for that opening statement and for your work that's being done both at a national and indeed regional level. And we might engage again on this, Chair, I would suggest, as a committee, maybe by the end of the year, just to follow the progress and indeed hear of the various seminars and whatnot that's been organised. We'd like to see further progress on that. So thank you very much.
Okay. Deputy Buckley, do you want to let Eugene in? I don't know.
Yeah, if
Eugene, are you there? Yeah, he had said he was going to be in and out, that he had other meetings. Right, okay, Deputy Buckley.
Thank you. They always save the best for last.
That's why I'm letting you in before.
No, first of all, I just want to thank you for your statement, and we all have, I suppose, a massive interest in this, but I just want to acknowledge as well Dr. Howlett, who is a senior parliamentary researcher. I got her to actually do a full research document on it and see what was happening and how could we change things. And in fairness, like as this says here on the second or third page, so the PQ from May last year noted that the Health Service Executive established the National Sepsis Clinical Programme with an assigned team to lead out on the objectives of the programme. The programme focused on sepsis awareness to promote early recognition, evidence-based management and initial work focusing on, and it goes on to the points and some of the points that you've made, and actually some of the points that are actually have been rolled out, which is excellent. And I have to commend you, because sometimes you're inside the committees here and it's attacked the HSE all the time. I'm not going to do that. It's the fact that this is a very, very short period, and starting from the baseline, and you've made massive strides already. I mean, if you're going, when you've doubled your hits on the website in such a short period of time, and we've always said awareness is education, and education is what saves lives, I do also welcome train the trainers. I've heard that a long, long time ago on some other things within the mental health system, and it does work. I can understand you do need to have these summits, and I think in the notes somewhere it said that there's one coming up on the 3rd of September or something, And that's about sharing lived experiences, sharing how they do it in other places, because I was very interested in the New York State law, because I was saying if we could get some kind of a legislative mirror of that you could actually get it into Irish law, but obviously it's just too complex and complicated, so we're probably going to go to a different base. I actually only have one question, because I said, in such a short period of time, like when we came in here first and listened to the very first opening statement only last year, a year and a half ago, to see something move so fast and so progressive has to be commended. And we don't have any evidence based on it, but surely it has saved lives already, and I know they're rolling out more on the ambulances, putting up, I actually have seen them, sepsis ones.
Yeah.
But us as a committee, how could we help you, or how could we assist you in anything that we could do to make progress even further? If it was through legislation, if it was through a policy document or a standardised document or something, is there something we as a committee could do to actually help you? Because it's something that's moving so fast now, you don't want it to slow down. Because a lot of things in politics, it takes a long, long time to change. And this is a very positive story. And me personally would feel like I want to push it forward, And I do welcome the 5-year plan. Some people outside here will say 5 years. 5 years, but in politics itself maybe is, but in the whole government structure over years, 5 years is not a long time. So my question would be seriously is, as a committee, as legislators, is there anything, and I need you to be frank and honest, is there anything we can do that can make your lives easier, make those who, God forbid, do contact sepsis? What can we do as legislators to make your life a lot easier? Thank you, Chair.
Thank you very much, Deputy Buckley, and I will give my colleagues here a moment to prepare their wish list.
And you can take all the time you want.
But I would once again acknowledge your work and the focus that you as a committee have brought to this important area, and I would also congratulate Dr. Howlett on that excellent paper that you commissioned. It's very balanced, and I think it provides you as legislators with a very balanced approach and an international perspective on the legislative interventions that have been made and the limitations of existing evidence. And I hope that document illustrated to you that a lot of the things that were mandated legislatively in New York were actually in place. And in place in this country for quite a while, and that given the evolving or the constantly evolving nature of this area of clinical practice and the emergence of new evidence, that oftentimes legislation isn't the correct instrument to use for something like this. So I think the support and the focus that you have given to this major cause of harm, the acknowledgement that it is an international cause of harm, and that not all of these cases can be prevented, and that we're all doing our best to prevent the preventable cases, is important work of itself. So I might defer to my colleagues if they want to add anything.
I'd just like to say and thank the committee for the attention that they bring to sepsis, and it's the very fact that we come here and talk about it really focuses our group's attention on the task at hand. It brings extra resource to us. The public awareness campaign that we've had over the last couple of months I don't think would have happened without the help of the Petitions Committee to draw attention to it. And then because of that, the whole team focuses on the outcomes, and we try and close those circles and provide good results. It is important to state, I think, when we talk about the legislative changes, to, I think, be aware, as Dr. Healy said, that the changes that the Stauntons brought to New York were brought because of deficiencies within the healthcare in that sector, whereas in Ireland, a lot of the legislative changes that they would have advocated for are already present within the health service, and it has some mixed effects, not all of which are good to legislate for a particular medical condition when it's so variable between patients. And if you legislate for a specific treatment, it can have unintended bad consequences for some of those patients. It's important to bear that in mind. It's important to bear in mind as well that sepsis has a high mortality rate. It's one of the highest causes of mortality globally, and aiming for 0% mortality is just something we should be aware that that's not going to be achievable. And certainly where we are in the low 20% mortality, we absolutely need to chip away at that to get that mortality rate down, but to be reasonable in our expectations as to what would happen. But I'd just like to thank the committee for the attention it brings to sepsis. I think that in itself has been very useful.
Thank you very much. And as my colleagues have said, I think it is an important function that you have. And then that kind of vehicle and that voice for the families who are watching us today. I suppose I have a long shopping list for children and young people here. We work in an annual budget environment, so that's why I think it's important that we keep sepsis up there as topical and important. So, we certainly welcome, discussions and awareness and all of that. Certainly myself and my colleagues were continually working on this. We've talked about education and training trainers, but we're working hard to improve staffing, to improve infrastructure, high dependency units for children and young people in our regional hospitals, for example. And I think just wherever wherever we can, that we understand, and I know the people in this room do, you've listened to the families and to what we've talked about before, just the importance of getting this right. So thank you.
Could I just be very brief? Love the honesty. The Library and Research and the Bills Office will be delighted with you. So, I mean, yes, it's about raising more awareness, but keeping it on the agenda. And that's what I'm saying. That's why I asked the question, how can we help you? Because if it is about, you are now gathering evidence as you move along. It's an evolving thing. And I've always been a realist. You don't save everybody. But there's a section in society that you possibly could. And that's what you strive to. It's not about percentages. Unfortunately, well, it is, but it's not, if you know what I mean. And as I said, that's why I asked that question. Because it's just and I do like it, was the fact that the international, the Society of Critical Care Medicine in America and the European Society of Intensive Care Medicine. So it's not a bubble anymore, that this awareness campaign is going out, and there has been collaboration. So I just want to say again, we will keep it on the agenda if it assists you. And obviously, by we working together, it assists everybody. So I think it's a no-brainer. So that's why I asked the question. So I just want to say thanks very much for this. Normally, I'm not stumped for words, but I am today. But it genuinely is, to me, and I've seen it over the 7 years I've been in here in committees and stuff, it takes so long even to take the first step. But this has been a good news story out of something so misfortunate, but has moved very, very fast. And we as a committee, or anyways, one on the committee, will work with you tirelessly to keep it on the agenda so everybody can benefit from this. So thank you very much. Thank you, Chair.
Yeah, just before I come in, Carrick, it's something that I had actually wrote down, that if with the HSE that we could keep in regular contact, maybe on a 6-monthly or even 12-monthly basis, that we can just keep it up. Carmen, you want to come back in?
Yeah, I was just actually on that point, Ciarán, that we might engage physically by the end of the year, but we would look at some interim reporting where you can appraise the committee on the update, maybe quarterly or something like that per annum, by correspondence purposes, and then if there is a need arising from that, we might engage physically. But I certainly think by the end of the year it would be good to kind of get a snapshot of the full calendar year, and obviously I await then the note on the costings year on year going back from 2018 through to current day. That would be good as well. Thank you, Ciarán, and thank you again for the witnesses for coming in.
Eugene, are you there? No, look, I just have a few questions myself. I suppose the petition itself started off, as the lads have said, trying to raise awareness, and I want to thank Karen and Joe and the Lil's legacy as well, but as well as the HSE. Is there any way to determine how successful it has been in the last 9-12 months? Is there any, and on your side, that you can see the big improvement?
Okay, so this is akin to a health promotion campaign. So with any health promotion campaign, the effects, it's difficult to ascribe the changes to one particular intervention, and it's also difficult to see it in the short term. All that said, when we evaluate, we look at structures, processes and outcomes. So we will evaluate this public awareness campaign as it's completed to inform the next one. So we should see the impact, and some of the figures that we've provided to you already in regard to website hits and illustrate some very short-term process measures, but we will have further public research and focus groups and surveys to demonstrate the impact. The sepsis program monitors the sepsis rates in the acute setting year on year. and measurement is always a challenge, and we wouldn't like sometimes a change in the figures can reflect better reporting and not necessarily a deterioration in performance. So that has to be interpreted with caution. But we also, and you wouldn't expect a huge change in those rates over a short time period. Maybe, would you like to add anything?
Yeah, so I mean, the whole purpose of the campaign was to inform the public so that they might seek treatment earlier, and that we know that earlier treatment is associated with better outcomes and lives saved. The way that the public awareness campaign then will be assessed in terms of the research that comes as a package with the awareness campaign is in terms of term recognition, so that if we said about half the people were aware of sepsis, we'd go back after the campaign and see how many more, what proportion of the public are now aware of sepsis. In reality, what we're looking to do is to show a decrease in mortality, and that doesn't really come out in the figures that we'll look at immediately after the campaign. We get those mortality figures through the HYPE system, and we won't get the numbers for a calendar year until 6 months after the calendar year. So the numbers we're actually interested in, we won't see until long after the public awareness campaign. We have to also, when we try and evaluate whether we go forward with this, it's quite complicated as well, because again, those unintended adverse outcomes, we don't want to be pushing people to emergency departments and to GPs thinking that they're very unwell because they've heard an ad where they're actually not. And we'll have to really consider how we might take the totality of that evidence, the increase in recognition, maybe an increased drive to the emergency department, and whether we see better outcomes and what they're related to. It's going to be a very complex process to try and figure out what's working, if anything's working.
Yeah, that was more or less what I was going to ask you next. With the 44% awareness rate, what kind of a time frame are you talking about for the evaluation, and how regular will the evaluations be done?
So as far as I'm aware, at the end of this burst of the radio campaign, the researchers will come back in and do their market research, and then they'll present us with results within the next couple of weeks, I think. And then we're going to have to sit down as a team and a group to discuss whether that was beneficial in terms of the outcomes that we want to see. We'll have to talk to our colleagues throughout the hospital systems to see if they're seeing any increased drive of patients to the hospitals, and then try and make a decision and a determination as to whether we would seek further funding for more of the radio and potentially television campaigns.
Is there a ring-fenced figure for sepsis campaign to continue? And if not, how long more can we expect that campaign to run with the funding you have?
We've sufficient funding to run this phase of the campaign and evaluate it, and then we'll submit for further funding. We've been fortunate to date in that we have been awarded funds as we've required them.
But there is no guarantee that on a yearly basis you'll get that kind of funding to continue the sepsis campaign.
I think
that's one of the things that we would be anxious that on the 6-month, 12-monthly period, that if you're having trouble finding that funding, that we as legislators can try and put pressure on, because I think we all agree that it has been a success compared to from the first time lads came in. But that success is dependent on funding the radio ads, television ads and all that funding is there the whole time.
Certainly. Thank you.
Yeah. Well, there isn't the whole pile. The last thing is, in general, with the pressure the health service is under, is there a worry that the sepsis campaign would kind of go off the boil because of other serious things, or is there a guarantee that the pressure and the campaign, and I as well as the lads, and I said it earlier, I want to compliment the HSE for all they've done over the last 12 months since this came on board, but is there any fear that with the health service under pressure that this mightn't continue and that the recommendations of the audits that will be carried out, that they won't be rolled out fully.
I don't believe there is, Deputy, acknowledging the wider pressures of the health service. Sepsis sits within those pressures and is affected by those pressures. You'll see from the supplement that Dr. Martin and I worked on and issued, and the alert in the height of the winter pressures this year, that we issued an alert to highlight the impact of those pressures on frontline staff's ability to recognise sepsis. Maybe Dr. Martin would like to comment on that. Do you want to comment?
Thank you. I think it would be, I think sepsis will always be there, and our clinical programme will be working continually. I think the fact that we have permanent staff in all of our hospitals who are there to address sepsis recognition, sepsis audit, it is very much part of medicine. Now, what we would love is that it's so much part of medicine is that you don't need to continually campaign, that everybody is aware, from families through GPs, through doctors, nurses, etc. But we know that that's a continual piece of work too. So I don't see it as going off the agenda anytime soon, and I think a lot of the work we've done will make sure that it stays on the agenda. Thank you.
Well, you've answered the last question I was going to ask you, is how long was the HSE'S current sepsis programme going to run? But you're confident that it will continue. Is there an actual set amount of hours per week that are dedicated to the sepsis programme, or is it just rolled into the health itself?
It's a major cause of harm within healthcare, internationally and in this country. Everybody needs to be aware of sepsis in the delivery of healthcare. And so in one way or another, every clinician is dedicated to sepsis as required. So there aren't a set number of hours that we think sepsis from 2 to 4 and think something else from 4 to 6. It's fully integrated in the delivery of healthcare.
That's just a lovely word there. That was my biggest fear. What we need out of this was it's fully integrated into care. That's brilliant. That's what I wanted to hear, to be honest with you, that it's not a burden, it's not overcomplicated. It's now there as the common sense approach that automatically when patients come in, they go, oh, possibly could be sepsis. We have to check for it. So that's what I mean by ingrained into the system. So thank you very, very much.
Can we get a guarantee? I won't say guarantee. Can we work? We say, as has been said already, that maybe a report on a 6-monthly basis or even yearly, that we just keep that pressure on.
Certainly.
With government. We understand you need the funding to continue these kind of programs, and if we can do anything at all from our side, that would help. I want to thank Dr. Healy, Dr. O'Dwyer and Dr. Martin for coming in to speak to us today, and the other guests, but also Karen and Joe are looking in to this at home, and thank them for actually bringing it in front of this committee in the first place, and that's where it has rolled on from. Look, this discussion has been very beneficial and informative to the committee, and we hope it just opens up doors that we can stay in touch with each other, and we'll consider the next steps to open it up. We'll now suspend the meeting for 5 minutes to allow the witnesses to leave. This meeting is now suspended.